All right, welcome everybody. So great to have you here. Happy Wednesday and welcome to Back Talks with Dr. Sean McWilliams, where we are a community that supports you if you are looking for natural ways of managing spinal pain, neck pain, low back pain, bulging disc, herniated disc, spinal stenosis, facet arthropathy. You are at the right place. Great to have you here. If it's your first time, welcome. So nice. I want to answer questions for you today. I want you to leave today feeling more confident, more hopeful about the direction to go if you're suffering with chronic neck or back pain. And if it's your 60th time with us, welcome back. Always great to have you here. Hey, leave me a message in the comment. If you don't see a response back from me, make sure you just refresh. You're live again. Sometimes the technology is not always perfect, so I can see you and say hello to you. Tell me where you're from. And if there's a question that I can answer for you, I want to answer it for you today while you're here, okay? So if you've been with us, we've been talking about different vehicles that people use and that you're going to get recommended to typically if you go to an orthopedic surgeon or a pain management person when it comes to having chronic neck or back pain. And so what we want to talk about today is nerve ablations. Should you get a nerve ablation? Is it a good choice for you? So without any further ado, let's get into it. So what is a nerve ablation? Well, with my big picture here, let me get rid of myself for a second. We want to unlock the truth about nerve ablations. I want you to understand, what are their benefits? There are some benefits. I'm going to let you know that. Are there risks? Yes, there are some risks associated with it as well. And you have other non-invasive options for managing your pain. So let's talk about it. And yes, that's what it looks like right there in that picture. So what is a nerve ablation? A nerve ablation, also called radiofrequency nerve ablation, is the official term for it. I'm just going to read this so I don't miss anything. Nerve ablation is a procedure that destroys nerves in an area of pain. Okay? It destroys the nerve. That's what it does. Destroying the nerves helps reduce signals of pain going to your brain. This can help relieve long-term chronic pain. Ablations may also be used for chronic low back pain, neck pain, and pain in other areas of your body as well. Okay, so that's what it's there for. And there are times and places for this. I just had one of my gentlemen in his 80s was having chronic back pain, severe spinal stenosis. We were doing a lot of work on him, and it would help him periodically. But man, he just kept. There's so much degeneration in his spine, and we thought the best option would be for him to go get an ablation, and it helped him a lot. So I'll give kudos where kudos are warranted, because there are times and places for this. If you're young, that's a different story, because you have to realize when you don't manage your spinal condition in a healthy way, and you don't do something that's proactive about getting your tissues to repair themselves, to reduce the positive pressure in your disc. If you're dealing with bulging disc or herniated disc, you are only putting a Band-Aid or making yourself worse by doing most of your surgical procedures. And if you don't believe me, you can look at the statistical side of success for usually back surgeries is somewhere between 32 and 38%. That's it. And there is an ICD-10 code for failed back surgery syndromes as well. That is a real thing. And if you get diagnosed as a failed back surgery syndrome, your insurance rates are going to go way through the roof, because no one else is ever going to want to touch you again as well. So there's a lot of complications. So we want to show you some positive alternatives that you can do that I actually think should be your first line of defense before we start doing invasive stuff. But who else is going to show you this? No one's going to share this with you. Most people don't know about this. Your doctors aren't going to tell you about it because they don't make any money doing it. So they're going to push you into vehicles that are income generators for them. And I would hope that their heart is in the right place, that they want to help you feel more comfortable. But you got to realize they're not going to talk to you about spinal decompression because they don't do it in their offices. This is not a big money maker. It's so much easier to go in and do a laminectomy and make $50,000 in an hour and a half than to do spinal decompression on you, which you can't charge as much for. So I want you to know that. So are there benefits? Yeah, I think we've kind of talked about the benefits of that. It's for pain relief, and sometimes it can last up to 2 years. I have seen in most of my patients most people didn't really get help from the nerve ablation. And a lot of people wound up having pain within 6 months to a year. And what you got to realize is that you numbed it. And now you have another year of decay and degeneration on top of it because you didn't do anything to make it better. And I want you to get better. And the people that are part of our community are people that want to get better. They want to heal their bodies from the inside out to the best of their ability without relying on drugs to numb stuff and without relying on invasive, dangerous surgeries a lot of times to try to cut out a bad part. We want to add to, not cut out and take away. All right? Usually when we take stuff out of our body, it's not always great. And not that there aren't amazing miracles with surgeries. There definitely are. There's no doubt about it. But when it comes to the spine, it can be a little bit different than that. So I always want to recommend that you go the right direction and in a positive way. So when we're talking about nerve ablations, this is basically how it works. They use a very specific, they use a needle, and it's hollow on the inside. And then what they wind up doing right here is they send this probe down into it, and then they use a radio frequency, and they heat this end of this probe up. It heats this nerve right here, and it destroys the nerve. And hopefully you don't have any pain. And that's how it works. How does the doctor know what to do? Well, he's using this video x-ray machine right here. So he's guiding the needle into your back and looking at your x-ray to make sure that it's going in the right direction. Here you can see a close-up of what he's seeing. So here you have the needle that's actually in, excuse me, and he's using, this is what he's doing. So over on the right-hand side, you can see where he's got a needle on the inside. He's going to do an ablation on all three of those areas. And so he's going to guide the needle in first. That's what you're looking at right here. He's going to be ablating the nerve right here around the facet joint. That's the facet joint, so that's what they'd be doing to you. And then they hook up this blue wire, and they send that radio frequency down into the end of that needle, and it heats up and it destroys the nerve. And that's how that works. So are there risks of nerve ablations? Well, there are. There's complications from it. On occasion, you can have permanent nerve damage because you're killing your nerve, which doesn't sound good, right? In some people, the original pain may actually get worse, and I have seen that, so you have to be very careful with these. Other complications can include infections and bleeding at the needle insertion. Even though somewhat uncommon, especially if you go to people that are really good at what they do, it is a real thing. So do you have other options? Do you have anything else available to you to manage this? Well, you do. And in most cases, if you have been with us before, spinal decompression not only manages bulging in a herniated disc with a quite high success rate, almost 77 to 93%, but it also works great on facet-generated pain, which is usually why they're going to be doing a nerve ablation on you. So you should always take a look at spinal decompression before you go get your nerves fried. So here's a really cool study from Goose and Nazasaki. This was done in 1998. This is the percentage of spinal mobility, pain reduction, and activity after spinal decompression. I mean, isn't that what we are all looking for? If you're dealing with back pain, you want to be able to move better, you want to have less pain, you want to feel more flexible. And so this was over a 200-person study. They had 71% improvement of their ability to move after this study was done doing spinal decompression. This is no injections, no drugs, no surgeries, no ablations, none of that stuff. Spinal decompression. 71% reduction of their pain. 78% improvement in the activity of their ability to move and be active in life again. And 77% pain remission long term. That's pretty incredible. You want to see some real stuff? This is a patient of mine, pre-decompression, was told by 4 surgeons that he needed to have this disc excised that you can see right here in red. On his axial view, this is called the axial view right here, A-X-I-A-L, axial view. It's like cutting you in half and looking up into your body. You can see this massive herniation right here that was totally clamping down on his left major nerve branch going down his leg, so he had chronic sciatic pain as well. This guy came in to see me. He couldn't even walk. He was laying on the table when I was doing his consultation. Here's what the nerve branch should look like. This white area right in here. That's what your nerve branch going down the other leg should look like as well. So you can see just how smashed that nerve was for him. Didn't do drugs, didn't do surgery, even though he called me from the emergency room. Here it was his post-MRI. So we're not just guessing at this stuff. I'm showing you real scientific proof that you can make changes in this. That's where his herniation was. Okay, and now look at it now. Almost totally gone. Totally sucked back in. It's like a turkey baster. Okay, when you're basting your turkey, when you're pushing out the juices in a way, which is water and oxygenated water and nutrition into a disc, you push it out, and then you want to suck it back in. So as that turkey baster sucks up more juice, it's creating a negative pull, and that's what we do with spinal decompression. We create a negative suction or pull to help retract the disc material back into where it's supposed to be, and only a millimeter change can make a significant difference in pain. So don't think it has to be 4, 5, 6 millimeters of change. The weight of a dime on a nerve can reduce 60% of the neurological information traveling through the nerve. The weight of a dime. So a millimeter of change of pulling that disc back in can sometimes change your life. And it changed this young man's life. And you can see here, 12 weeks later, you can start to see his nerve branch again, right in here. You can see that massive reduction of that disc. Now, we still have a little bit more work to do on him, but at this point, he was totally pain-free. He was flexible again, and that's what you want. Start being able to live your life. And now he's a dad, which is super cool. Here's another one of my patients as well. Here you can see this massive disc herniation right here. Severe low back pain, severe sciatic pain as well. And look at this. Here's his axial view. You see all this black material right here? That's the herniated disc material. That's the jelly because it had too much compression pressure on it, called positive discal pressure, and it squirted out. It's like when you take the turkey baster and you squeeze the turkey baster and you shoot it out. That's what's happening right there. And look at this guy, severe muscle weakness, diminished lumbar reflexes, could barely sit and perform his job. This is the same gentleman 12 weeks later. Look at the difference in this disc right here. And go up and look at this. You can totally see his nerve branch now, all right, which is right in there. All that got sucked back in. So, yeah, can you do this? Absolutely. Should it be your first line of approach to managing your back and spine? In my 25 years of experience working in surgical centers and working in a non-surgical center, 1,000%. Yes, but you want to get it done by someone that knows what they're doing, that can help guide you, who's nationally certified in spinal decompression, so they can help you have the highest success rate. And the beautiful part is that if you don't have somebody in your community, and there's nobody in your town or local areas, and I know that's happened out west a lot. There's the whole reason I created Disc University. There's not a lot of doctors in the cities out there, in farmland, and out in major rural areas like that can do spinal decompression. So yeah, of course you're going to be offered medications and drugs and surgery. And that's why I created Disc University, so that I can come to you in your home digitally. It was like cloning myself and teaching you how to do spinal decompression and everything else that you need to know how to do to manage your spinal pain and get it healthy again, get your spine to be healthy again from the comfort of your home. You don't have to go to doctor's offices. There's no co-pays. You don't have to buy any equipment. You don't have to really worry about how you're going to get your kids and who's picking them up from school. You can do all this from the comfort of your home. And if that sounds like something that would be of interest to you, please make an appointment with me. Let's talk. Tell me what's going on with your back. I want to help guide you. If I'm the right person, I'll tell you what to do. If Disc University would be a great fit for you, I'll let you know that. And I'll be honest with you. And if it's not, I'll tell you that too, and I'll give you my recommendations on what to do. So how can you get a hold of me? You can go to booking.drshawnmcwilliams.com. And that is a direct link to set up a consultation with me. There'll be a form that you're going to fill out. It's going to let me know all about what you've been dealing with, suffering with, what you've had done. So it'll give you so we can have a really good conversation. And I have some ideas of what you've been through and where you'd like to go. based off that form. So fill that out, and then you'll see my calendar, and you can make an appointment with me, and we'll sit down for 15 or 20 minutes and we'll chat, and let's see if we can add some hope to your life and some sunshine to your life, okay? So bookings.drshawnmcwilliams.com. That's the best place if you want to set up a consultation with me. If you just have general questions, you can always direct message me and either leave me a comment on YouTube or Facebook. You can do messages me there, or Instagram as well at dr.shawn.mcwilliams on Instagram. Hi, Marisa. Nice to have you here. Well, Marisa was just on our Instagram once. I think she knows a lot about what we talked about. And we had a guest with us as well. Maybe we'll have a guest here, see if we can get Dr. Kenny Benfante from the famous New York Spinal Correction Center on Staten Island, who is a spinal decompression specialist, to come and join us again, as he did on Instagram with us today, and share some of his knowledge and his expertise. And he did an amazing job. We had a great time with him today, and I'll see if I can talk him into joining us here, so you get them on Facebook and on YouTube as well. So Marisa, great to have you here. Any questions I can answer for you before we hop off? There's always a lag in the technology, so you gotta wait for it to catch up. Well, while Marisa's thinking about that, please remain hopeful. I see a lot of you on Facebook posting in groups, showing me your MRIs. I know it can be super frustrating. I know sometimes people don't know exactly which direction to turn. The direction to turn for most of you is a non-surgical approach. You should always try that first. So remember, you can always do things that are more invasive in your body, but once you do things that are more invasive in your body, turning them around, if it doesn't go well, is very difficult. So start with the least invasive therapies first that have the highest success rate, and spinal decompression is the one that does that. And you can do it from the comfort of your home using our course, Disc University. So if you'd like to chat, make sure that you go to bookings.drshawnmcwilliams.com and set an appointment up, and let's talk, and let's see if we can get you feeling better ASAP. Okay? All right. Thanks for being here, guys. I love and appreciate you. I'll see you next Wednesday.